Hiya, I want to apologise first of all because I haven't done a video in a few months, which is really bad of me, and I know a few of you have commented and messaged me wanting an update, and so this is what it is, an update on how I'm doing. So I had radiotherapy. I finished that a few weeks ago. It was 3 weeks worth of radiotherapy at the University College London Hospital. They have a really great team there. The only fallback of being treated there was that I'm based in Hertfordshire, which is about an hour and 20 minutes train ride in, and then obviously back again. So I was looking at about 3 hours travelling each day, but hey, you know, it's a small price to pay for going to a professional, great team of people. So like I say, the worst part was the travelling, and I say the waiting to be seen. Sometimes the machines had a lot of fit and wouldn't be working, would have to be quickly serviced and then be seen. So sometimes you'd wait up to an hour, but you know it's part and parcel of having cancer. A lot of the time you spend waiting around in hospitals, you get used to it and you sort of become a bit indifferent after a while to the waiting side of things. The worst part of the actual thing is completely painless. It's a localised procedure, so I'd say the worst thing was just having to have your arms raised for the treatment itself, which would range from around 10 minutes to half an hour, depending on how well and efficiently they can line you up, because your body needs to be placed in very precise position, with, you know, coordinates mapped out on your first radiotherapy planning session, because the radiotherapy needs to be directed at just the one area of your body, obviously my right breast and up to the collarbone, because the lymph nodes were affected. There was little side effects to this treatment. It really was a walk in the park compared to chemo. I didn't feel fatigued at all. I could go about, you know, my business as usual. The only thing was it took up a lot of my time. Obviously I was there every day, so I couldn't do much else. I'd come home and then I'd just rest, but I didn't feel worse in myself like you do with chemo, where you feel the muscle aches, or you know, you start feeling a bit tired. But with this, all it was, the worst part was the arm raising. I'm afraid the arms do go numb and that's uncomfortable, and you get pins and needles and stuff, but you know, whatever, it's not that bad, get over it, right? Also, your skin is slightly affected, and obviously that depends upon how long you have the radiotherapy for. Mine was just 3 weeks, so I got away with it. Of course I have an implant in as well, so I was nervous about how that would be affected with the radiotherapy. As far as I'm aware, it's fine. It may be slightly stiffer in terms of movement, but I'm due to go and see my wonderful surgeon on the 1st of March, next Thursday, and he's going to check it out. He's going to discuss my further surgery. I'll be having a reduction to my left breast, and also obviously I need the nipple reconstruction and the port taken out, and so there's a few more tweaks to be done in terms of surgery, but I mean, that doesn't worry me. I'm, you know, in a way looking forward to it, because once the boobs match up, I'll be feeling so much more confident in my body. You know, being so young, having your body and being comfortable with it is so staple to your self-confidence. So, you know, I'm excited about that, as long as it's not on my birthday, because I will not be having surgery on my birthday this year. Also, because the armpit is affected skin-wise, as it's sort of like a thinner, delicate skin, that did get red. It wasn't sore though, and I recommend placing organic aloe vera gel, 99.9% pure. You need to find the purest, on the skin immediately after treatment. It really helped. It really calmed the skin. It speeded up the healing process. It was healed within a few weeks post radiotherapy. They do give you a cream, the hospital does. It didn't work for me. It sort of reacted with my skin, made it a bit rashy, so I discontinued that, and I used E45 cream for the moisturising side of things. That worked really well, and the rash was cleared up soon enough. You aren't allowed to use any creams or anything, hair removal creams on the armpits. I'm afraid you will have a hairy armpit for a few weeks. That was cleverly disguised with shirts like this, so you know, it's not the end of the world. Just don't go waving your arms around in the air, and you know, then people won't notice. So like I said, March the 1st I'm going to talk about my further surgery, and then mid-March I go to my oncologist again, which I guess I'm a bit nervous about because there'll probably be discussion about, you know, follow-up scans and, you know, seeing how things are. So, you know, you can't, you know, think that treatment ends and then everything's fine. The anxiety is with you for life, but you just have to try and place it on the back burner as much as possible and get on with things, because it's always going to be there, and you worrying obsessively about it will not help the situation. Also, hair update, I'm still wearing wigs, I'm still rocking wigs because it's how I feel comfortable. I feel comfortable in them, I hardly notice they're there, it makes me feel more feminine. Even though underneath this wig I actually do now have a full head of hair. It's 3 inches, it's really thick. It's my usual mousy blonde colour that I was blessed with when I was born. So I think around April time, just before my birthday, I'll have it dyed. My hairdresser keeps telling me I must have my hair trimmed. I'm a little reluctant, I must say. I've been obsessing over as many inches of hair that I've been growing, so to have to part with any of it is really, you know, horrible, but it has to be done because whilst it's growing out, you're still going to get some like fuzzy bits and it needs to be sort of pruned and get nice. So I'm going to do that in a couple of weeks. I'm going to face that fear, and then I reckon by about April time I'll have to say goodbye to the wigs and try to rock a short hairstyle. Don't know how that's going to go down, but we'll see how that goes. So really there's not much else to talk about at the moment. I've had my treatment, I'm waiting for surgery, and right now I just want to try and get to, you know, back to some sort of normality, whatever that may be. I really want to write a memoir. I'm in the process of doing that, so look out for that. It's going to be about not only my experiences but about the issues that affect a young woman, and I don't think that's addressed all that often because, you know, breast cancer at my age is so rare. So things like the effect it has on your sexuality, how you communicate with a new partner about what you've been through, when do you tell them, you know, as so to not scare them away, things like that, and how your friendships with people are affected, because they undoubtedly are, and also how you exist in a world that is so vain and everything is about self-image, and knowing that you are different, that you've had to lose a breast and that you've had to lose your hair, such staple elements of your femininity. So things like that are going to be discussed, and I hope a lot of you will be interested in reading that, because I think it's so important that we're aware of these issues as women and men too. So yeah, that's your update. I will do more videos, I promise. You know, after my meeting with my surgeon I'll let you know what the plan is. So yeah, see you soon.